Thank you, Paula and Kathy. We're going to go ahead and open up the floor now for questions, and everybody should have a box on the right side of their screen for typing in questions. So feel free to type in questions, and we actually already have some, so I'm going to go ahead and start asking away. And our first question is from Brittany, and I think both Kathy and Paula could probably answer, but it just simply asks if your hospital continues using or allows patients to continue using a multivitamin during treatment.
This is Kathy. Yes, we do. We do kind of try to steer patients in the direction of cleaner supplements, and if they've had 2 or more blood transfusions, we ask them to use a multivitamin supplement without iron.
This is Paula. I concur with Kathy that we do have them on either an IV or an oral supplement during their transplant course, and even longer for children who are on immunosuppressive medications.
Excellent. And kind of a follow-up to that is, after what minimum period of time on a steroid therapy do you recommend calcium supplementation?
I can start with that. Well, basically, like I said in my presentation, we do not supplement with calcium until after the tumor lysis period has passed. And then basically our diet histories, we're looking at the child's diet and sources of calcium. And even so, in addition to that, we go above and beyond the RDA like I had outlined. As far as is the question continuation after steroid use? Lisa?
Yeah, it's just after what minimum period. So is there a time frame, say if they're on I think, and Stephanie, you can type in now and correct me if I'm wrong, is there a minimum time period where you would automatically, or do you do it based on each individual?
Oh, I
so
see.
If you've been
okay.
on them for 2 weeks, do you automatically start them on one, or is it just a per person?
We pretty much supplement everyone, even if they're good milk drinkers or dairy, they have good dairy intake while they're on steroids. And then after, if some of the kids, we may lower the dose. If they're on like 1,500 milligrams per day, we may, lower it just to kind of complement what their dietary intake is. If some children are having a great difficulty taking supplements and their milk intake or dairy or calcium intake is adequate, then we may just stop them temporarily until they go back on steroids. But when they're on steroids, we definitely keep them on supplemental calcium and vitamin D.
Excellent.
Ms. Paul, and we typically do have our patients also on calcium as well as vitamin D supplementation during steroid therapy. We also do DEXA scans at day 80 post-transplant, so that gives us some direction in terms of if we would need to continue the supplementation once they go off the steroids or not.
Excellent. And we have a question for Paula from Lindsay. She's asking, what guidelines do you follow during the transplant process regarding bringing food into the hospital from outside, from home?
We do have a policy, so if parents do want to bring food in from the outside, of course it needs to be in compliance with the immunosuppressed diet. If it's something non-perishable, we ask that it be like a new unopened box of crackers or cereals that can just stay in the patient's room. If it's something perishable, the parents can take it directly to the child's room to eat it, and if they're not ready to eat it when they bring it, we don't allow individual refrigerators in the room, so we have more of a community refrigerator. So they can take the food, date it, and label it, and put it in the refrigerator, and it can stay there up to 2 days. We just ask if food has been in a patient's room that it not go back into the refrigerator since other patients are using it.
Excellent. I think this one would be for Kathy from Lori. Do you worry about antioxidant intake, i.e. vitamin C, during chemoradiation treatment and possible interactions?
Great question. We actually do. We try to steer our families, our patients, away from using antioxidants in high doses during chemotherapy and radiation. So yes, we do try to counsel them to avoid. They may be able to stay on just a general multivitamin, but we really discourage use of vitamin C or other antioxidants while they're actually getting the chemotherapy or undergoing radiation.
Excellent. We have a couple of questions here about feeds. So one, which formula are most commonly used during the stem cell transplant process? Whole protein, semi-elemental, elemental, or maybe you use a variety, Paula?
Typically in the children I've worked with, I think most of them tend to tolerate the semi-elemental or the elemental formulas better. We've had a couple children further out that we've then switched to an intact formula, but I'd say for the most part, just a slow infusion of an elemental or a semi-elemental tends to work best. A lot of times we, go up on the rate and then have to go down depending on their tolerance, but these typically are the formulas that we choose.
Okay. And do you worry about placing a feeding tube when a patient is neutropenic and or thrombocytopenic? And have you had any issues with leaking around the tube?
Ooh.
If an actual gastric tube is placed versus an NG?
Well, I can start this. So we do have to make sure that the child has adequate platelets before we can place the NG tubes if their platelet count is low. I should have remembered the threshold. But yeah, we do take that in consideration. So if someone's platelets are too low, we would give them platelets before placing the NG tube to prevent bleeding. And we actually no longer use gastrostomy tubes or PEG tubes, unless the rare occasion these days would be someone like the patient I presented who has a perimeningeal mass, and during the course of treatment we pretty much lost NG access because of where the tumor was, and then the child also had some liver complications, so we ended up having to place a PEG tube. But we've stopped doing that in our center because the risk of infection was so high that the kids were in the hospital with infection around the G-tube sites more than almost any other sequelae. So that's why we're such advocates for nasogastric tubes. But I have had some kids with Down syndrome that actually come with at diagnosis with G-tubes who have leukemia, and yes, occasionally there are some leaking around the sites, and so we've had to involve the GI team or surgery team depending on how the tube is placed to help manage those tubes.
As far as transplant goes, children who have come to us for transplant that have NG or G tubes in place, we do try to utilize them as long as we can. However, once conditioning begins and they end up having vomiting and diarrhea, then we have to put that aside. Typically our NG tubes do tend to be placed later in the transplant period, so by that time counts and platelets are usually pretty adequate. As far as G tube goes, typically those patients are well further out of transplant. They've been on NG or ND tubes for a long period of time, and it's just been established that they're just not picking up on their eating. So again, we're probably talking many months out where a G tube may be placed.
Excellent. And I just want to be aware of everybody's time. It is we have just about 1 minute left. But before I forget, I also want to tell everybody that there is a CEU available, and it will be it will be available. What you want to do is you want to keep a copy of the handout for this presentation in your file for ADA. And I have time for one more question. It's a follow-up question from before regarding the vitamin C. And do you also, it's for Kathy, do you also worry about interactions with folic acid during the treatment process?
Oh, another great question. We do. This is actually kind of a study area for us right now. And basically our leukemia group, we have decided, we have never encouraged, actually discouraged dietary folate intake around high-dose methotrexate, which is the time period that you need to avoid excessive folate. So we usually have our patients who are taking additional folate in a supplement to stop the supplement during the time they're receiving high-dose methotrexate. So yeah, we are concerned about that. We don't worry about what's in the diet because it's probably not enough to interfere with the antifolate chemotherapy. However, supplementation, yes, we do ask them to put that on hold while they're receiving the methotrexate.
Excellent.
Yeah.
Well, I want to thank everybody for coming, and I hope that you enjoyed the webinar today. And it is time for us to close, so I apologize. There were a few questions that we didn't have time to get to, but I hope everybody has a wonderful day. And again, you can get one CEU for this. You just want to keep a copy of the handouts in your portfolio. So thank you, and everybody have a good day.